I'm gonna have you turn your head slightly for me. I'm gonna listen just here at the neck, just below the right ear. Hold here. Sometimes it's the smallest of things that we hold on to and just need a bit of an external release. And we're letting it go. Hi, Cami.
Hi, Doctor. How are you today?
I'm doing well. How are you?
I'm doing all right.
Thank you for coming into the office. I have you in for a bit of an overall kind of cranial nerve examination today.
Yes.
I do think we're going to take a bit more of a holistic approach to your examination today. I have a couple things that I'll be testing. Slightly more passive exam. I'm more so going to be having a look at the reactivity and seeing how well you're functioning overall. I know you've had a little bit of increased stress recently, so I want to see how exactly it's been impacting your cranial function.
Okay.
Okay? All right. So I'm going to begin by kind of having an overall assessment of your energy, having a look at you as a whole, looking for any signs of asymmetry, swelling, anything like that. Do you have any questions for me before we get started?
I don't believe I do.
Okay. If at any point anything is uncomfortable or painful, you are more than welcome to let me know.
Thank you, Doctor.
Of course. So I'm just going to start by kind of getting a gauge for just your overall well-being. I like to just kind of have a passive look before we start with any of our assessments. So just looking over the upper body. We tend to hold a lot of tension here at the back and the neck. So also having a look at the hair and scalp health. Your hair appears very healthy, very well groomed, nice and clean. Beautiful texture. Having a look at the skin surrounding the hairline and along the face as well. Just coming around, having a look at the front. Clavicular lines are even. Having a look at the chest wall in line with the abdomen. And then, of course, your face. Nice and clear skin. Very even tone. Complexion is clear. Very well moisturized. Doesn't appear overly dry. Start with a few palpations here and there. Cami, you're going to feel me kind of move around with my hands. I want to feel for any areas of tension. Is there anything in particular that's bothering you today?
The back of my neck has, kind of in between my shoulders, I feel like I'm carrying a lot of weight there.
Okay.
It feels just a little bit more tense than usual today.
Okay, so I'll just palpate around here and see if there's anything in particular that I'm feeling as far as tension. Feel here as well at the shoulder. Sometimes these areas can be connected as far as discomfort. So just going to start palpating up the neck here. As I come down, I'm going to come over towards temporal mandibular joint, coming down towards the chin, following your chain of nodes here. Checking for any signs of swelling or inflammation. And coming down towards the clavicle. Palpating along the chest wall, feeling for any signs of edema. All right. Just gonna have a brief inspection here with my pen light. I'm just having a look at the overall health of the skin. any signs of concern. External ear appears intact. Eyebrows are nice and full, very even, structured at the tail, no signs of sparseness. You have beautiful eyelashes.
Thank you.
Nice and full. Having a look at your piercings. You have several piercings. They all appear to have healed nicely. No notable signs of infection or swelling, no inflammation. As I come down towards the neck, having a look at the thyroid. No signs of swelling here. I'm just going to feel. And visualizing the chest wall again. Skin is very clear, nice and even. Okay. So I'm just going to have a look at your arms, Cami. I do see that you have a tattoo here. Appears to have healed nicely as well. Skin again is very even in tone. I do see just a little bit of bruising here.
Yes, I took a fall off of my new bed frame.
Oh, okay. So let me just have a look here. So they're look like they're in their second stage of healing. About how long ago was the fall?
I'd say maybe 5 days ago.
Okay, so yeah, so they've had a couple days to heal. We can see that they're starting to turn color here. Are they causing you any pain or discomfort?
When pressed, but other than that, then it usually doesn't hurt.
Okay. So this one here looks like it might be a little more on the tender side. Is it still in the purple stage? So
Yeah.
just be slightly careful there, but nothing in the joint, no injury to like the wrist itself.
No.
All of that feels okay. And if you open your hand and close your hand, all of that feels okay.
Yeah.
Okay. All right. Very good. Okay. All right. Got it. All right. So I think the next thing I want to do, Cami, is perform a bit of a stethoscope auscultation. So essentially what this is just a device that's going to allow me to auscultate or listen over different areas of the body. Now, this is really important for a couple of different reasons. I want to listen to your overall circulation. So not so much doing an assessment of your heart rate or your lungs. I do want to listen to your respiration and your breathing, but more so to see your base level of cortisol, if there's any underlying stress, anything that could be affecting sleep, that kind of thing. Okay. So I'm just going to place this in my ears. All right. So you're going to feel a fairly cold sensation on the skin. Just to give you a warning, it can be just a tad startling. So I'm going to start here just below the clavicular line. Just going to hold mild pressure. And I want you to just breathe normally, Cami. I just want to listen to any signs of underlying stress. Anything in the body that can be holding tension. I do hear just a little bit of occlusion. It does sound like there might be some barriers to your relaxation. Have you turn your head slightly for me. I'm going to listen just here at the neck, just below the right ear. Sometimes any occlusion of the ear canal, the tympanic membrane can radiate down the side of the neck and lead to increased pressure. gonna come over on the other side. And again, starting just below that clavicular line. Just continue to breathe normally for me, Cami. Now listen directly over the heart chakra. I just want to hear if there's any signs of occlusion or distension here. I do have a slight blockage there. Slightly tachycardic over the heart chakra. Does indicate just a little bit of stress. And listening again just below the line of the left ear, parallel to that tympanic membrane. Just gonna listen at the crown as well. Maybe some mild distension here. Okay. So I'm gonna come around the front. I'm going to auscultate with the bell side of my stethoscope, so if I can just take your hand, I'm going to listen externally first. I'm hearing just a little bit of stress here as well. Sometimes stress of the hand indicates an internal feeling of lack of control, so just something to note. Slightly elevated there as well. You have beautiful nails.
Thank you.
So same thing, I'm just going to listen here externally. I do feel just again a slight bit of occlusion here as well. I have you rotate for me. I'm just going to hold this for a second. I just want to hear. Okay. All right. Okay. Let you relax for just a second there, Cami. All right. I am going to just perform a couple measurements here. So, noticing a bit of asymmetry and energy shift from the left to the right side. So, I'm going to measure a couple things. I'm going to start shoulder to shoulder. Mild shift at the shoulder. Just measure the whole of the cranium. Just over 22 inches there. Just at 12 inches, right above the throat, so slightly under there, maybe some occlusion at the throat chakra as well. Measurements can be helpful for more than just the physical sense. Sometimes we measure for internal inflammation as well. All right. So I am getting a read for what exactly it is that you will need pertaining to today's cranial testing. And I think we should start with some therapies before we proceed with any more of our physical examination. I want to get you into more of a relaxed state before we start with any further testing. So let's give you a little bit of an energy shift here. So I think the first thing I'm going to do is trial some aromatherapy. So I'm going to have you close your eyes. I'm going to have you smell 3 different scents. And I would like you to choose one based on what you think will benefit you the most. So with your eyes closed, this allows you to choose a scent based on what you need, what you're feeling subconsciously. So we will start with our first scent. Now they are fairly concentrated. This one smells quite nice. So I'm going to bring this closer to your face, and I'd want you to just take a sniff here, Cami. Smell that in. And just hold on to the memory of the scent. Secondary scent here. Let me just get this prepared for you. Very different profile here. So coming in with our second scent, I'm just going to waft that to you. Okay. And lastly, again, very different profile here. So just waft that in, Cami. And I want you to open your eyes and tell me which of the 3 you think resonated with you the most.
I think probably the second one.
The second one, okay. So the second one was lavender. So it's a very interesting choice. Kind of indicates the body's need for increased state of rest. Maybe you've been feeling some instability recently. Everybody's journey is quite specific, so we will utilize the Manta Lavender Aroma Dot for today's cranial examination. So I will get this prepared for you. So I'm going to place this in our little Velcro holder here, just like that. Then I'm going to place this in the mask that I will be using for this portion of your exam. So I'm going to place that inside our mask just like so. All right. I'm then going to measure and adjust here based on the measurements I obtained. So we did about 22 inches at the whole of the cranium. So just make sure that that is adjusted appropriately. Now, this is the part of the exam where I'm going to place something over your eyes.
Okay.
And I'm going to ask you to just relax and allow the therapies to take place for the next few minutes. So you'll see that within the Manta Sleep Sound Mask, there are tapered edges of the C-shaped eye cup, so it won't put any increased pressure on your lashes, so not to worry there. So I'm gonna have you just take a breath in for me, Cami, as I come over the eyes. Just breathe. The fabric is very soft, nice and flexible, so it won't cause any irritation to the skin. Is that feeling okay so far, Cami?
It feels good.
Looks like we got a good fit. You let me know if that aromatherapy becomes too intense. I'm just going to feel around for any shift in the energy at the initial placement of our sound mask. And I'm now going to adjust the Bluetooth component so that it's in line with your ear. Fully adjustable on both sides. And the sound mask does come with an optional over-the-head strap for easy sleeping. Secondary therapy I'm going in with is our Manta Sleep Sound Machine. Now this is one I find particularly helpful, and then I did hear some blockages just below both ear canals. So I'm going to play a sound, and I want you to just take 5 normal deep breaths for me. So we're going to breathe normally, but just slightly deeper on inhalation, slightly deeper on exhalation, okay?
Sounds good.
So you're going to hear a sound play now in both the mask and externally on the sound machine. And I'm just going to adjust I want you to let the wave wash over you, Cami. I'm going to do some vibratory therapy of the cranial nerve here at the ear. The variation of sound in the Manta Sleep Sound Mask, as well as the sound machine, creates a barrier that repels stress. And doing some vibratory therapy over that blocked heart chakra. Releasing any of that energy. Allowing your body to disengage from any stressors. Rebuild the natural chemicals that produce within the brain. I find that the combination of increased touch with deprivation of sound, and then increased stimuli with the sound machine help induce a relaxing state, increase tranquility, release that pressure buildup specifically here in the neck where you said you were feeling some excess tension. I'm going to go in with a peppermint smudge. invigorating mint helps further release any of that tension. Alright, Cami. Gonna hear a shift in the sound as I turn off our Manta Sleep sound machine. And simultaneously remove our sound mask. I want you to allow yourself a second to adjust. As I remove the mask, just take some normal breaths in for me. As we continue with your cranial nerve exam, I'd like to thank Manta Sleep for sponsoring today's video and for allowing you the opportunity to experience some of the therapies provided today with our sound mask and noise machine. I will be sending you home with our lavender aroma dots, and you can use code SIESTA for 10% off any future purchases with Manta Sleep. That will be both in the description box and in the pinned comment of this video. As we proceed with your examination, I'm going to test for any decreased areas of inflammation. So you're going to feel a very cold sensation. Just want to give you a warning so it doesn't startle you. I'm going to start at the forehead and work my way down, following a few very specific lines here. I am seeing some improvement at the temple. Still showing some mild inflammation at the clavicle. So we might need to do just a tad more work there. As I come across on the left side, again, following down. Definitely decreased on this side actually, seeing a bit of a variance there. So your right side is still just slightly more stuck than your left side. So it appears as if there's something we're holding on to here. So I'm going to do some reflex testing. I'm going to perform some percussions, try to loosen up some of that stagnant energy. Could be something that you're holding on to because of your fall. It could be something that you have going on in your personal life. Whatever it is, it's wanting to cling to this right side. So we're just going to percuss. You might start to feel a shift. Sometimes it feels like a heavy pressure and then a swift release. Just focus on your breathing. Definitely starting to feel a shift here. Sometimes your sinuses can start to release pressure as well. So if you feel your nose running or your eyes start to water, that's all part of the process. Big release here. Okay. Just gonna hold here. Take a big deep breath in for me, Cami. Good. And swift release out. Good job. Very good. Definitely notable difference there. Temperature variation is also notable here. We're getting a cooling at the chest. Release of tension there. Are you feeling any better at the back of the neck here?
Yes, I am.
Okay, good. Yeah, certainly not as much on the left side. sometimes our tension on one side of the body can actually be held at the other side of the brain. So it appears as if your left brain is stressed slightly. So I'm going to do some very gentle acupressure therapy. So I have this kind of flat cotton tool here. So I'm going to apply some just mild pressure here at the corner of the eye. So you're going to feel me press and hold. Small circular motions. Press and hold at the third eye. Very good. Definitely noticing some decrease in tension there. I'm going to come down. I'm going to press and hold at this point here, just in front of the ear. I'm going to do a small pumping motion and increase some of that lymphatic drainage. Release any fluid that you might be holding on to. And come down and do the same thing here, just below the ear again, pumping motion. I'm going to come down, following the chain of nodes on the right side. I'm going to stop here just above the initial point of the clavicle. Just going to palpate here and hold and palpate and hold. We're going to come release at the shoulder. Release at the shoulder. Very good. Do a bit of hybrid therapy here, Cami. So you're going to feel very cold. I'm going to touch you with it. A feel for where exactly you need to release. So I just feel still some stuck tension here. Definitely there as well. Okay. All right. So I'm just going to finish up with some closing shift here. I do feel like we've released a fair amount of the tension at the base of the neck. Not feeling quite as tight, certainly not feeling as much rigidity here. Decreased temperature here just at the base of the head as well. Good. I'm just going to do some last little readings of your hair. Release any micro tension that we might be holding at the base of the scalp, the front of the scalp as well. I'm just going to do a light hold here. Sometimes it's the smallest of things that we hold on to and just need a bit of an external release. All right, Cami. I hope that at the end of your examination you are feeling just a little bit better. Some slight release of tension, anything that we may have been holding on to. I would like to see you in again for a future visit. I think you maybe could be due for some more therapies if we had more time. So I will leave you with that. Once again, I'd like to thank Manta Sleep for sponsoring today's video, and I hope you get home safely.
Thank you